Every study they've done shows, again, you're decreasing the amount of virus that is exhaled, the amount that you're exposed to. I mean, I think, a long time ago proved there's no doubt that masks work.
I have some things to say too. We've been learning for a year or more about this virus, and we've learned from other countries' experiences too. And early on, we shut things down so quickly, we didn't have enough data to learn what the mask did, but they had data in France and lots of other countries where they actually compared rigorous mask wearing with enforcement versus laissez-faire mask wearing and distancing, and showed multiple times there was data that showed that there was much less incidence and much less spread of the COVID. So it was not necessarily one study, it was just a preponderance of data that we accumulated over the last year that shows that masks decrease transmission and give the wearers somewhat protection. I mean, it depends on which mask you're wearing. Unless you're wearing a really heavy duty N95, it doesn't give you a lot of protection, but it keeps you from giving it to other people. So.
I think it's more important. I don't think that it's a matter of doubling up. I think it's a matter of properly wearing the mask that you have in hand, covering your nose tight around your cheeks, making sure there's no gaps in the coverage on your face for the parts that you're trying to protect, and that is your nose and your mouth areas.
Totally agree.
Okay.
I know there's some experts that have come out and said, national experts, that double masking is the way to go. I don't know anyone that really enjoys or can breathe with two masks on or communicate effectively. So it's not very practical, and I don't know that it affords you much more protection.
And I would add too that on some masks you do need to be fit tested for those, and you would run a chance of becoming ill or having a heart attack or a respiratory problem as a result of wearing them if you're not properly healthy or you're not healthy enough to do so.
Yeah, I would just add too that not all masks are equal. As we're talking about, medical grade versus N95s we wear in the hospital,
versus these,
that type of thing. So when I tell people to double mask normally, it's because they want to wear something like my daughter, or something fancy that matches her clothes, so she can wear the medical mask under and the nice mask above.
Right.
They're still working on the data on that. They're still not completely convinced that fully vaccinated people can still carry or shed the virus. I think there's more and more data now that says probably not, right? I mean, have you read
exactly,
that?
Exactly.
And that's one argument. They still are not 100% sure, and I think it's hard to discriminate at this point. Do you have a badge? Do you tattoo it on your forehead that you're fully immunized? I don't know, but I think that's a difficult one. I think we can gradually move away from masks. We know the incidence has popped up in the last few weeks. Spring break, extra virulent strains, maybe, I don't know, different reasons why, but.
I think that you could argue you could not wear masks if you're around a group of people, your immediate friends and immediate family that you've spent multiple days and hours with, and you're familiar with where they've been and what they've done, and the same for you. But I do know that there is some statistics that will show that wearing of masks is working, and at this point, if it's working, why stop a good thing?
Exactly, I was going to agree. I said, like in the hospital where the majority of our workers are all vaccinated. I mean, we've lessened the restrictions in meetings. If everyone has been vaccinated, we still socially distance, but we meet without masks. That's we've moved to that. But in the hospital too, I'll be honest, long term we struggle with the fact because when you're not talking COVID, you talk about we haven't had a single influenza admission this year to the hospital.
Yep.
Outside of COVID, we've had less employee illness than ever because we've been a little bit better about mask wearing. So I know I've had some talks with some other healthcare organizations talking about, at least for nursing and patient care areas, we may continue people wearing masks for quite a long time.
Well, the same thing goes with the children in school settings. They haven't had nearly as much illness out in the community, so there's not as much absenteeism. Of course, they've gotten quarantined intermittently and eliminated for that reason for contact tracing. But yeah, I mean, it's and we learned that from last summer. The Southern Hemisphere didn't see any flu, So we expected that we probably wouldn't see much either. So that was a nice bonus. The one thing about masks, though, I see so many people wearing them outdoors, and there's a lot written about whether or not to wear them outside. I think if you're in a really tight group outdoors, sure, maybe, but otherwise, outdoors, it's well ventilated. It's extremely unlikely you're going to pick up COVID. Some people still think if they step out the door from their house, they're going to get COVID just breathing the air. They don't need to wear masks
Right, I like the
outside.
single jogger on the people trail
Or the
wearing
single
their mask.
bicyclist out on the
I'm
street.
fairly positive it's
And-
probably okay to take your
And
mask
there's
off.
nobody
in that
around, they
instance,
just,
so.
somebody driving in a convertible with the mask and nobody else in, come on now, I think people are still afraid,
Maybe
the
their car
virus
needs
is
cleaned
still
out,
there.
their car might make them sick, so I
I
don't know.
know, but those things we can kind of lessen. People are tired of wearing masks, I know I am, and some people seem to like it, I guess, but I think for the most part, we don't need to wear it then.
I would say again, what type of mask were they wearing? And let's face it, no one's gonna wear it 24/7, right? I mean, you can say I wore it most of the time. I can say back in the beginning of this pandemic, I was very good, better than any of my friends at wearing masks. But were those times I forgot to wear it, or maybe I touched my face without thinking? There it were. So I think it's very hard to say that 24/7. Was I wearing a medical grade mask, or was I wearing a cloth mask that doesn't work as well?
And I think it goes back to understanding what a mask does. I think from the beginning, unless you're wearing a test-fitted medical grade N95, which is what the healthcare workers wear when they're in a high-risk setting, like taking care of COVID, or even the PAPRs, well-ventilated, really sealed. If you're just wearing an average mask, it does not protect the wearer that much. And I think that's a common misconception from the beginning. People think they're protecting themselves when they wear this. They're actually keeping, if they're sick, if they have COVID, 50% of the people who are contagious, not 50% of the population, 50% of the people who are contagious right now don't know it. And this keeps them, it really diminishes their ability to give it to someone else in a social setting, so.
And I think you can prove that they do work, because look at all of our healthcare workers
Yeah.
who treated COVID positive patients and they didn't contract the virus. So therefore, I think that does speak volumes to
Yes.
the success of the wearing of masks.
That's the same thing.
Yeah, I
mean,
think
masks
I-
does
my-
not protect the individual.
Odor has a way of penetrating a lot more sometimes than germs. So I think it's just the natural. It's the fibers in the mask. No, I'm not. I don't know. I don't know if
That
I
goes
really know
back
the
to
real
that
science
test
behind
fit
it.
procedure for medical grade masks.
Yeah.
Is they do have a thing that they have a scent, and if you can smell it, the thing isn't working. So, but the average mask that people wear is not that protective, and you can smell and you can acquire COVID through the mask. Distancing is probably more effective than wearing the mask, actually. The state is saying they want K through 12 to wear masks to the end of the season here, to the end of the school year. Then they'll reevaluate it. I think that's the stand, government buildings too. Otherwise, it's an advisory. Some businesses can be more stringent if they want to.
I think in that instance too, in the school settings, it's harder to maintain social distancing inside. And if that's just an extra layer of protection from our students so that we keep them in school, because God knows they've missed enough as it is this
Exactly.
year, that's just a small step to keeping them.
And they did change the quarantine and contact tracing guidelines recently, within the last month, that said if children in a classroom were wearing their masks, 3 feet is adequate, and they can really be a lot more liberal with not eliminating, they won't shut down the whole class. There's a lot more liberal guidelines that allow the kids to continue if they're wearing masks.
I think you just keep, at this point, the success of wearing them is more important than just the desire to not want to wear one any longer.
And again, it doesn't protect the child necessarily, it decreases the amount of spread from child to child.